Oke, selamat siang. Assalamualaikum warahmatullahi wabarakatuh. Apa kabar Bapak Ibu? Baik. Kalau mau duduk lebih ke depan boleh. Let me speak in English so our two speaker know what happened in this room. Good afternoon, everyone. Welcome to our public panel discussion, Active and Aging Well, Two Perspectives on Living a Good Life. I'd like to start with my personal experience, actually, as a researcher in aging. I've become increasingly aware of the importance of preparing myself for my older age. So when I go back home, I have a cita-cita, like I really want to retire peacefully. So I need to prepare myself from the beginning, from now. Staying physically and socially active to age well. So I start to walking every day as part of my routine. But since returning to Indonesia, I find myself struggling too, like really struggling for me to start to exercise regularly outdoors. Because one of the things that makes me really reluctant to go outside is because the pedestrian infrastructure is not really safe for me in my perspective. And I noticed that how easily that reason makes me unmotivated to go outside and then just stay home watching Netflix and do nothing. And I think I'm not alone in this kind of experience. So this is exactly what today's discussion is about. What does it take to actually live actively and age well in the real world with all its barriers and complexities? This afternoon we have two international experts who will each bring a different perspective to this question. We've also reserved plenty of time for a Q&A, so please do engage. We want this to be a conversation. And if you want to speak in Bahasa Indonesia, I will try my best to translate it into English so our speaker can understand the questions. So our first speaker is Professor Bert Steenbergen from Radboud University in the Netherlands, where he is a professor and vice dean at the Faculty of Social Science. Since 2017, he leads the Active Living Program, an interdisciplinary initiative bringing together research, education, and collaboration with over 20 societal and industry partners. His work focuses on understanding and promoting physical activity across different contexts of life. So please welcome Professor Bert.
Thank you. No, the will work. Thank you. Thank you very much for the invitation to be a speaker here on this. Do you call it a symposium or?
Just a discussion.
A discussion. Okay, so it has to be a discussion. So I will be short in my presentations. Normally I do presentations like 1.5 to 2 hours, but I've tried to decrease it a little bit. So I will just introduce to you that what we call it the challenge of active living. You already alluded to it. It sounds very easy, but yeah, to have an active life. I mean, with all the challenges today. I just went for a walk just before this talk, and I thought, oh, yeah, it's nice to have a walk, but it's pretty warm actually to walk around here. So there are challenges there, and I will just lead you through. So if I can have the next slide, please. So this is a slide from the World Health Organization, and they actually show that there's only a mild percentage of people that reach the minimum activity guidelines. I won't talk too much about the activity guidelines, but basically it says that you have to be, maybe you can get the next slide, you have to be active for about 150 or 300 minutes a week, which is not really that much if you think about it, but still it is difficult to reach. And in addition to that, you have to do some muscular exercises, and this is particularly important for the, well, I'm also older, I can't say old, but I say older, I'm 59, so for me muscular training is also important, and that's for the older generation, it's really important. Have the next slide. So then you have to think, okay, what do you regard as physical activity? Because when we started off with this whole program on active living, people thought we were wearing, how do you call it, the lycra and sports pants all day, but that's not the case. I mean, active living is about being active and not doing, sports is a part of it, of course, but that's only one part of it. And if you look at these different graphics, there's different ways in which you can be active. I mean, for instance, if you're older, I know a couple of older people that have community gardens. So they walk to the community gardens, work in the garden, and that's also a form of activity. And then if you do that, you'll reach your minimum physical activity guidelines easily. So, and there's other things like dancing, brisk walking. I didn't do brisk walking before I went there. I did very slow walking because of the heat. But so there's different contexts in which you, or different ways in which you can be active. Can I have the next slide, please? Then also there's different context. Well, I'm from the Netherlands. Well, Ita knows the Netherlands. We're basically born on a bike. That's what we always say. We do a lot of cycling. But in our country, humidity is not that high as here. It's not that warm. It's pretty good climate. I mean, in the winters are pretty cold, so never go in the winter. You know that, Ita. So, I mean, there is different context in which you can be active, and most of our students, if they go to the university, they do that by bike. Some take the bus, but a lot of students that live in Nijmegen take the bike. Some walk. So transportation to work is one way in which you can be active. The other one is occupation, physical activity. So that's basically work. Well, my work doesn't involve any physical activity apart from studying it, because I'm sitting basically the whole day, and sometimes, like here, I stand, but this is not very extreme physical activity. So in your work, you can also be active, but that, of course, depends on what kind of work you have. Then you have leisure physical activity. That's I heard that there were yoga classes here for students. That's a great way to be physically active. We've done some studies with students, and what they like to be physically active, but they say, well, we don't want to go home first, then come back to school and do some physical activities. We like to do that extended after the lecture. So that's nice that you have that here as well. And then the other one, I have to say I'm very bad at that. That's household physical activity. I don't do a lot of household activities in the house. I'm afraid. I do some how do you call it, cleaning with hovering, and but that's yeah, I do dishwashing. But But for the rest, we have a cleaner. We're lucky to have a cleaner. So my household activities are pretty modest, I have to say. But there's different contexts in which you can be active, and it doesn't have to be one context. It can also be a combination of contexts. Can I have the next slide, please? This is just a fun slide. So I just said that we do a lot of. I mean, my work doesn't involve any physical activity apart from studying it. There was a survey, and it shows that. So this is Europe, and so basically, so this is the Netherlands. The purple one, yeah, this one. It's very small. It's 150 kilometers in width and 350 kilometers in length. So and we're with 18 million people. So it's pretty crowded, and it's a small country, nice country to live in, but with the #1 champion in sitting behavior, and that is because we have a lot of jobs that involve sitting behind your laptop, doing all kinds of administrative work and those kind of things. We don't do very physical work in general. Okay, can I have the next slide? There's something to it. Okay, so I have a couple of slides left. So 2012, the World Health Organization said there is a pandemic, and actually there was a journal article, that's this one, that appeared in The Lancet. It's a very good medical journal. And they talked about the pandemic of physical inactivity. Basically what they said is that people get more and more inactive with all the associated health and other problems. So maybe can I have the next slide? So these are like health benefits. So for instance, diabetes type 2 is a lifestyle, can be regarded as a lifestyle disease. So it has to do with your food intake, but also has to do with your physical activity. And it's one of those diseases that you can actually reverse without taking medication, so changing your lifestyle. The other thing is that there are less healthcare costs because in general people are a little bit more fit and don't have so much diseases. More labor productivity, increased individual and social well-being, and I think that the last one is, I think particularly for now, also very important. There has been quite some research on people that are physically active that also involve a larger social network, and that means that they have more people that they relate to, and it's probably two sides, because probably they also work out or do activities with other people, so they meet more people, and that's for their social well-being a very good thing. So I always think health benefits is more than just disease, but it's also your whole social well-being, etc. Can I have the next slide, please? So this is, if you click one more, then I think there's probably, yeah, thank you. So this was the other pandemic. It's in 2022, the COVID pandemic, and there has been some research on what happens if you're physically active or not active at all. And I thought these were pretty striking results. So if you look, maybe I go over here. So these are people that are consistently inactive. So there's people that don't do a lot of activity. These are people that consistently meet the physical activity guidelines, what I said in the beginning, so it's very mild physical activity. Hospitalization was 10.5% here versus 3.2% here, so that's a third more, or less, whatever you regard it, if you're a little bit active. And with this one, so people that deceased, you see 0.4 here and 2.4, so it's almost six-fold more diseases with people that are physically inactive compared to physically active. So there is clearly in this case with the COVID pandemic shown that there are health benefits. Next slide. Okay, so this is my last slide, and then always the key question is, of course, well, why do you do it? Well, that's always funny because there can be multiple. I mean, there's always multiple reasons. It can also be that, like here. If you don't have the place, for instance, to walk or those kind of things, then you don't do it. But I always find it funny. This is a pretty large study with 28,000 people. And number one is I don't have the time. And for me, not having the time is probably not a reason, but it's an excuse. Because you can always, like I said with yoga classes, then you just have to factor it in during your day. So you have to make it easy that you become physical active. So that's what I wanted to say. I think that was my last slide. If I'm correct. Yeah, I was. Thank you.
Thank you so much, Bert. It's a really fast presentation, actually. No, it's okay. So we've heard about the science and the challenge of active living. So now,
You're doing together?
Oh, together? Yes. Okay.
Is it okay?
okay. And now we turn to what happens as we age and how we can age well, mentally and psychologically. And our second speaker here is Professor Nancy Pachana from the University of Queensland, Australia. She is a professor of clinical Geropsychology, co-director of the UQ Aging Mind Initiative, and program lead of the Age Friendly University Initiative at UQ. Her work focuses on mental health in later life, and UQ is the first university in the world recognized as dementia-friendly university. And I also follow that. I attend one of the trainings. Please welcome Professor Nancy Pachana.
Thank you very much for having me here, and my presentation follows very nicely from Bert's because a lot of the things that he talked about are really key for healthy aging, especially being active, and that includes being socially active as well. So social networks are important. I thought I would mention that we are also an age-friendly university, and so that means that we are part of 150 other universities that are part of the World Health Organization age-friendly world. So we have age-friendly hospitals, age-friendly cities, and age-friendly universities. And it means that all of the parts of the university, research and teaching and community engagement, start with the idea that aging brings benefit to the individual and society, not just burden and cost. And I think that this is really an important message, because I think that all of us have can have some ambivalence about aging. So I am 61 and older than Bert. And I think even someone who studies aging can think, what will it be like when I am 70 or 80? But I also think that if we do not think about this as a university, then, if we have an attitude that is a stereotypical attitude, that older people cannot contribute, that they are not a part of society anymore, then this gets translated to our students and it impacts our research. And so for me, it is a very important issue to not have a bias when thinking about older people. Next slide. So this is why it is very important to study aging. So this is from the United Nations data, and from 1950 to 2050. And the green line is people living in the whole world, 65 and over. And the blue line is children, age 5 and under. And these lines crossed in 2017. And so the first thing you notice is this line is going far up, this line is going far down, and these lines will probably never cross again. It is not a temporary situation. So why has this come about? It has come about because of many good things. So we have much better public health system. So we have clean water. We know about basic things with nutrition. We have good medicines and education about health, right? And in particular, we have much better maternal health, so lower maternal mortality and lower mortality for children. Then we also have education, and this has led to, among other factors, a decrease in childbirth rates. But if this is the way the world is, and it is Indonesia, Sub-Saharan Africa, Japan, the United States, Australia, right? Then we must have a focus on how our older adults being part of society. So if you look at Europe, Europe has had a long time to have slowly rising higher mortality rates, right, or longevity rates. So it took 150 years for France to have 15% of the population be over 65. So 120 years to adjust slowly. It took South Korea 20 years to do the same thing. So then, how do all of the systems change? How does the hospital change? Do you need nursing homes? How do you educate people about caregiving? So the rate of change in Asia, and the Asia-Pacific region in particular, is very rapid. And so the society has to grapple with questions about how can we ensure that older people are living a good life. Next slide. So people have not studied aging for as long as they've studied younger people. And so you see a lot of theories about aging only coming out 1970, 1980, 1990. And at first, people thought that aging was a lot about decline, that older adults are always declining more, that the brain cannot renew brain cells, that older people cannot learn, they cannot pay attention, right? and as more and more longitudinal studies are happening, then people found, oh, okay, if you follow people over time, people can continue to learn. So you can continue to learn new words, new vocabulary, well into your 80s. How fast you push a button, that declines when you're 30. Very sorry.
Yeah, with that.
So then, when people thought, then they started rethinking the theories about aging. But they still said, Rowe and Kahn are very famous. Okay, what does it take to be successful in aging? And they said, well, you should avoid disease. Disease is very bad. You should avoid it. And you should have very high physical functioning, very high cognitive functioning, right? And you should have very strong social networks. And that seems like maybe that's a good idea. Maybe that could be a recipe for healthy aging. But what if you have type 1 diabetes? What if I'm born with a hearing disorder? Does that mean that I cannot have successful aging? And this, to me, seems very unfair, and it seemed very unfair to other people as well. There's also, if you think about not young people, middle-aged people, older people, if we think about it as lifespan, then there's going to be a lot of changes over the lifespan. Good things happen and bad things happen. So you need a way to capture that in order to talk about successful aging. So then they modified their theory. Next slide. And now you see that they have said that it is more about maintaining function instead of avoiding disease, which might be impossible if you are in a car accident, right? You are doing nothing wrong, and yet there is a big consequence. Now they are saying, whatever your circumstance, if I maintain that functioning, then I am doing well. So I am minimizing risk of disease. I am trying to do the right things, right? And I'm maintaining my physical activity. So I'm continuing to do what Bert said. I'm going to choose to walk up the stairs. I'm going to choose the longer way to go to work. I'm going to do extra vacuuming. Actually, there has been a lot of research around which types of activity do best for healthy aging. And what do you see? Dancing is very good. Why? Because it is physically active, mentally active, I must remember the steps, socially active, I have a partner, right? The one thing that consistently does not help healthy aging is housework. So you must get a maid. This is my strong advice for healthy aging, is to get a housekeeper. And then the other thing for successful aging is continuing engagement with life. But again, it may not be so simple to do these things, right? Because what if I start to lose my hearing and I do not get a hearing aid, and hearing aids are expensive here? Then I won't talk to my friends as much, I won't go out as much, right? And my social network declines. If I care for a relative with dementia, then my health starts to decline. I may start to get depressed, right? So we always have to maintain a vigilance about how we are coping with the various changes that occur at each point in the lifespan. So this is my slide from the World Health Organization. And so 2020 to 2029 is the decade of healthy aging. It was really good to start with COVID, I think. I think COVID was a great way to start the decade of healthy aging. So the decade of healthy aging, the World Health Organization wanted to show people a very simple way that we can help each other age well. So each person has their intrinsic capacity. What is it that I can do? right? And so I'm a professor, so I'm very good at standing around with a microphone, and talking, and I could talk for many hours, right? If I was a person living with dementia, maybe I could still, participate in music. Maybe I can still listen to music with my family and sing along, perhaps. Maybe I can still do simple things around the house. So I have a functional capacity, right, that varies based on my intrinsic capacity. So intrinsic capacity is cognition, so my thinking, my emotions, my mobility, right? It also includes how all those things are working together. But an important thing is the environment. So I must say that I love the University of Indonesia, Universitas Indonesia. It is very great. It has terrible places for walking. There are moats and holes and broken bricks, and the environment, I would say, is not so good at helping, right, the ability to walk. So intrinsic capacity would be mobility, and the functional ability would be my ability to go to the other side of campus, right? So if I was in a wheelchair, or if I had a walker, or if I had a cane, it would be very difficult. So it never is only the person that is responsible for successful aging. The person is always in an environment, right? It could be the physical environment, like the building or the pavement. It could be how people are reacting to me. And a lot of times when you live with dementia, people get very frustrated at you. And sometimes people yell at people living with dementia. And unfortunately, the person with dementia does not understand the words, but they understand the tone of voice, right? So the environment is not very good for helping them keep whatever intrinsic capacity is available so that they want to do things. And so you see people with dementia withdrawing, right? So in the decade of healthy aging, the World Health Organization is really challenging people, governments, society, community, family, and individuals, right? How can they make the environment support the person? How can we recognize intrinsic capacities that still exist? Don't always just look for what is not there anymore, right? You have to say, what is the person capable of doing, right? So that then you can have the most functional ability. And the last thing that the World Health Organization says is, well, what is successful aging then? So their response is simpler than pro and cons, because they say it is when the person can do or be the things that are meaningful to them. So it is not my wishes, it is the person's wishes that are most important. And that is why I think for my university to be dementia friendly, this has involved listening to people living with dementia to try to understand what it is that those people, what do they want to do and be that is meaningful to them. And I think that's it. Oh no, I have a whole last slide. It's a false ending. So, yes, this is my last slide, and this is from a little bit older WHO World Report on Aging and Health. And really, it is a diagram about what you would aspire to if you were to age well. So the blue line is your functional ability. So we already talked about that, right? Intrinsic capacity plus the environment. And earlier in life, the person ideally has a high and stable capability, and then it might decline a little bit. And it could decline quite a bit if they have a disease process, right? It could stay fairly stable if they do not have a disease process or everything is going well. But they could decline quite a bit if they have a disease. And dementia is a disease, right? It is a disease like lung disease, heart disease, depression is a disease, anxiety is a disease, and dementia is a disease. If everyone in the room lived to 100, only about 50% of the people in the room would have dementia. The other 50% wouldn't. So it's really important. It's a disease process caused by physiological changes in the brain, right? And unlike depression, we have lots of ways to fix depression, but we have no way to fix dementia. So probably later, like, it is one of the biggest public health issues, is more and more people having dementia. So when it is earlier, a really good thing you can do as to decrease, say, risk of dementia is to prevent chronic conditions, right? So if you have coronary conditions, this is a major risk factor for all types of dementia, including Alzheimer's disease. But also other chronic conditions like respiratory conditions or coronary conditions themselves can lead to a lot of frailty, lack of mobility, changes in eyesight, for example, diabetes, so endocrine disorders. All of these things will decrease how well the person is coping. So health services should help the person prevent, right? And the environment should promote capacity-enhancing behaviors like physical activity, right? Also, if people live in a low SES area, right? So they may not have access to good quality, fresh food at an affordable price. Everything might be fast food or a lot of alcohol or things like that. Then, as we move on in time, and we're talking about later ages, now we would really like to slow declines in things like memory or slow declines in social isolation or decreased risk of depression, right? And so you can do these things, you know, if people have the capacity to be mobile and be with other people, if they are, again, physically active. These are all very important. But once you get here, once you get where the person is very disabled, so they maybe have moderate to severe dementia, maybe they have chronic obstructive pulmonary disease and they have to be on oxygen all the time. They have severe mobility issues, so they need to walk with a walking stick or in a wheelchair. Now there's a lot about management. You know, we really would like to preserve as much as possible. So health services are really about managing these chronic conditions as the person continues to get older. And as we age, you know, everything from our responses to medication to how our behaviors change in dementia, it's very dynamic. It's always changing. So your healthcare professionals need to be aware of that. And then we really need to continue to support these kinds of behaviors, like making sure that people with dementia can be outside for part of the day. That helps reset circadian rhythms, and they can sleep better, and it might even help them a little bit with their appetite. But if they are very close to dying and they are in palliative care, how can people have a dignified ending to life? And there, a real key is pain management. Is the person, are people aware of when this person is in pain? A lot of older people have arthritis and they're in constant pain. And if I have a headache, I can just go in my purse and take a pill. But if I have dementia, I cannot ask for the pill. All I can do is maybe get angry, maybe throw something, and no one understands why. And so that's why it's really important for us to try to help the person interpret their behavior so that we can make sure that it's a dignified, high quality end to life. And really, a big thing is, are there barriers for people getting health care or getting especially mental health care, which is probably less access to care? And so we need to say, what about people in rural areas? What about people with low level of education who may not understand these illnesses? You know, how can we really help that there are less barriers to access to these sorts of really key public health initiatives? And of course we need cats. And you have a lot of cats here, so this is very good. I think this is very good. This is my cat, Grace. So I am really happy always to receive emails and questions, and I am also really happy with Bert to take questions now. Thank you very much.
When I started, I forgot that, please apologize because I never introduced myself properly to participants. My name is Latifa Hanum. You can call me Hanum. I am a lecturer here at the Faculty of Psychology, Universitas Indonesia, and my research topic is aging studies. And now we already have two speakers talking about their presentation, talking about active life and aging, and we open for the Q&A session. Is anyone want to start?
Thank you very much. My name is Ari. I was a lecturer here. I am now in retirement. I am 71 now. And what I like to ask is not about myself as an aging person, but more for the people near me, especially my children, to make them understand that even if I'm aging, it doesn't mean I'm a disabled person. Yes. Why I'm asking this, because I have noticed from some time, my daughter especially, is trying to tell me that I should limit all my activities. I should not go out all by myself with transportation, that I should always be somebody. I don't want to make her to be scared of me. I want her to understand that I could still do something. Of course, it's limited, but she does not need to be that scared of me. So, I think this is important too, how to make them understand, realize, and accept that I'm an aging person, but I'm still able to do things myself. Thank you.
This is such an important question.
Yes.
And we had some discussion. I have been here for the whole week doing workshops and seminars. And it came up in one seminar that isn't it true that as people age, they become more and more like children? And I think that this is not true. Because if you are an adult and you have children, then your role is as a parent. And even if you have very advanced dementia, you are still an adult. And you still have, in some way, some deep understanding that that is your role, even if you were to forget all of the names of your children. And I think that sometimes it is easier for children to think of a solution that it could be maybe very much out of love that keeps the parent safe, or that makes a decision simpler. But I think that this is not really acknowledging that the older person has the right to want to continue to do things like the World Health presentation says, that they want to be, or that gives them meaning in life. And so if you want to take a walk, if you want to do whatever you want to do, then that is what is giving meaning. And if you have a life without meaning, then it is a very not worthwhile life. But to make children do things is very difficult. When they're small or when they're big, it's very difficult to make children do things. I think that my best advice is to have an honest discussion about what is the fear. So if the fear is falling, say, if you go out on a walk, the data shows strongly that the less you are active, the more likely you are to have a fall. The more likely you are to not be able to do things like to lift out of a chair without pushing on the arms, to do things that let you do basic things in life. And I think if there can be that discussion with love, over time probably, then maybe you can make an inroad, because the older person has the right to do things that give them meaning. How does that sound? Yeah, and then
Yeah, maybe I can add to it, because this is parent-children, but it's also expectation management from the healthcare system. So we in our university, we work a lot with physiotherapies and also occupational therapists. And they always say, well, I think the better ones, they say the worst thing you can do is not doing anything. If you, for instance, have a fracture or something, you can lie down for 2 or 3 months, but you get muscle atrophy. So then, if you want to rehabilitate, then again, it's a long way. So being active is also. It's also. I know that children might think, okay, my mom is old or my father is old. I just leave him in the couch and it will be okay and it's safe. But it's a bit paradoxical, because it's actually not very good, because you're better off doing something. And that I mean, you should monitor it. I mean, you shouldn't run a marathon or something, but I mean, you can start easily off. And I know from studies in physiotherapy and studies in rehabilitation that, especially also with, for instance, sports injuries, so it used to be the case that they cast your leg, and they say, okay, you're not going to do anything for 3 months. But they don't do that anymore. They say, well, sometimes in extreme cases they do it, but in most of the time they say, okay, you stand up, try to do a little bit as quickly as possible. But so I think also healthcare, apart from parents, children, I think also healthcare professionals should sort of bring that message, like it is better not to leave your mom on the couch, but it's better to go, for instance, for a small walk or something.
Yeah, because I also do research about intergenerational relationship, and I guess there's a lot of things happen between older adults and their children, and sometimes the children really want to protect you, and that's why they have things like, please don't do this, don't do that, and then, but you still need to be active. They forgot about that. So open communication between you and your daughters may help. But if not, I'm a clinical psychologist, I'm here, if you need help.
Can I say one more thing? Because it also goes the other way around. That's actually interesting. I was once at a conference, and I know more about children and young adults than I do. Sounds a bit odd with older people, but anyway. So we were talking. So it was a physiotherapist, and it was about motor learning in younger children. So it is also in parents we call them very protective parents. The parents that don't want their children to fall or those kind of things. And then I was in the room with a physiotherapist. We did a dual presentation, and she started off with all kinds of little movies about children that fall. And there were a lot of parents in the room. They were like, oh, they like you can't have your child falling. And she basically said, well, they don't get hurt. It's just you have to learn. And that's also from parents to children. They sometimes also sort of pave the way and say, well, you know, you don't want to fall and all those kind of things, but you're not learning from that. So it's also, I think it's also the other way around. Again, it's also a little bit of expectation management, we call it sometimes. Like, okay, so why that? It sounds a bit odd, but like, okay, so what is when do children learn and when do older people learn? I mean, and like you said, I completely agree with that. I mean, there's a lot to learn, and no matter how age you are, so to speak. So.
Yes. Just, yeah.
Every generation needs to learn about the other generation. Is there anyone want to ask the question?
Thank you for insightful presentations. My name is Puspita. I actually want to ask something that maybe this is from a perspective of someone who is going to be aging, but still relatively young, I think. But I want to ask, do you think with aging, with your experience yourself, you grow a different mindset or bias too? Because I met some young people from Germany years ago, and he complained about Germany being aging and so many political decisions and regulations really towards the aging population itself. And as a young person, he said that, like for example, my basketball court nearby my house is not being renovated for so many years, and it limits the young people to connect, to have a network, to have a conversation, something that they really need at that age. And because I think Indonesia is not really an aging country yet, you can see from the regulation, it's not really prone to aging people. Like, as simple as the age the pension age, it's very young, I think, like 55 in the industry, 55, yes. So it's really, it's not really pro towards aging population, but do you think in aging country, you see that regulation is also not pro towards the young population? And in your opinion, what is the best solutions for this matter? Thank you.
So I think that this is a very, you can get into this argument where it is as though we only have $1 and we must decide if we are going to spend the $1 on older people or younger people. And I think that is then hard, because then if that is the way you view everything, then whichever way you decide, it is to disadvantage the other people. And we were talking earlier, Bert and I, about a park that is designed to help younger people be physically active. But then he said that a lot of the kids were brought by grandparents, but the grandparents had no bench to sit. So then it makes the grandparents not bring the children. So then the use of the park is for no one. So I think that it is really important to understand lifespan and intergenerational, so that when it's policy and decision making, that we don't have that either one group wins and the other person loses. And one way to do that is like my slide about the healthcare system, to have a lot about preventing disease and preventing illness, and very important things like physical activity and social activity are key. But I also think that you need to work with existing things in the society. What is in the society that can help promote these things in a more natural way? So I was looking for things to do in Jakarta, and I see that you have a cultural center that has the different style of home from each part of Indonesia, from Borneo and from Sumatra, right? So who holds the culture? Many times it is older people who hold the culture. And older people would really like to pass that on to younger people. So I have been to places in say, Thailand, where they have intergenerational crafts, where they do things like here would be maybe batik or something like that, right? So I I think it's really easy to say this piece of infrastructure or that piece of infrastructure, they are putting more emphasis one or the other. But I think that it's more than just the government and more than just the individual. I think we need to think about all of the parts of society that could be helping to foster that. And also what might be a barrier. When we talk about young people are much more isolated and lonely than older people. This is true in all countries that there has been data. And I see, you know this in Australia and here in Indonesia, they are having social media bans for younger people, and part of the upshot of that is that people spend more time being physically active. So I think you also have to think of what are some barriers that are preventing people from either kids being physically active, or for older people, social media, a lot of scams or trying to take advantage of people. So these are things that you could lose all your money and have very unsuccessful aging. So if you think about old societies, Europe has the oldest societies, like Germany is one of the oldest countries, and Australia is relatively young. But you hear the same complaints in young countries than old countries. When you see in the media, they pit the generations against each other. Old people have all the houses in Australia. Young people can buy no houses. We should kick all the older people out of houses. Like, this is not a good solution. So I will let the older European countries speak.
Yeah, I think the key here is basically what you said already, sort of dual use of things. And I can probably illustrate that with an example that we have in Nijmegen, so my hometown. So we work also quite a lot with the council. So how do they do the spatial planning in order to create a society or a town that sort of stimulates people to be more active. And I had a student group and that I supervised, and they got an assignment from the council. And that was basically, how should we go along with the playgrounds that are in the Nijmegen area. So basically we have about, I didn't know that, but we have about 300 playgrounds in Nijmegen, in the city, in the town. They had money to refurbish the playgrounds, and they asked us, okay, what should we do? And the playgrounds, I have to say, they're extremely boring, because there's a swing, there is a glide, and they're pretty much all the same. They're all fenced off, so they're not inclusive at all. So then we asked the council, okay, but what are your plans? And they said, well, we're going to place a new swing, we're going to place a new slide, but that's basically not a good way, because like we were talking the other day, so most of the people that go to playgrounds, and this sounds a little bit odd, but are grandparents, because they're most of the time there with their children. But if there's no benches around, for instance at the playground, or no places where you can sit, well, then the playground is pretty useless actually for use. So we advise the council, and I hope they will take it up, but you never know with council, but that they should sort of make playgrounds where they are, maybe abolish a couple of playgrounds, maybe just get rid of a couple of playgrounds, make a nice soccer field or something, but make some playgrounds where there are more benches and more things that people sort of gather, and people have a sort of community. And in that case, what you also said, then you have the intergenerational aspect as well, because then people meet there, and it's not a playground, but it's more a meeting place between younger and older generations. And I think that's a way to go, because it's, like you say, it's pretty much stratified, all those things. I mean, it's like, okay, we give money to playgrounds for younger children, okay, we give money to elderly home for older children, but you should make use of the dual use. I pretty much like that you have the benefit of both of those, or maybe also more groups, like also playgrounds, get rid of the fences, so that people with wheelchairs can also access the playground. So that's something, but it's a lot of, I have to admit, it's a lot of communication, a lot of talking, well, a lot of what we do in the Netherlands, a lot of coffee drinking with people from the council to sort of persuade them and to also come with data like, okay, this is good to have a playground, to design a playground like that. So.
But the other thing is that I think that if I was a young person and I felt that no one was listening to me, then this is a problem. And if I'm an older person, I cannot feel listened to, and this is a problem. So I think, councils and people who have resources, it's good to have a meeting just like this, right? You could have a meeting and ask people what they might like to do, and no one would say, just put another swing. Some of the young people might say skateboard park. Older people might say, but I really need a water fountain because it gets hot and, I can get dehydrated and this isn't good, that I can fall. So people can really contribute a lot to public and policy planning if they're given a voice. And even if you say, well, we don't have money for that this year, but that's a good idea, we may be considered, then at least the person feels like they have been heard.
We talk a lot, maybe, but maybe one more thing. So part of that group that I supervised was a study trip to Copenhagen, which is in Denmark. So the Scandinavian countries are pretty far ahead of that. And because I think of that, because you say, so what they did, there was a part of Copenhagen that was sort of a low SES, and there were I think there were 40 different nationalities there, and the streets were very dirty and all those kind of things. So they basically, the council, they reached out to the community there and said, okay, what do you want? What do we, if we're gonna completely refurbish this whole place, what do you want? And like you said, there were people that said, well, we want water fountains, we want boxing things, that was for the youth. So they designed the whole park. And basically what you see in the park there is a sort of reflection of the people that live there. And I think it's really great to see. And it's also a great meeting place. So you see the people meet, we talk with the people and say, yeah, it's a great meeting place. And it's also, that's maybe a long shot, but it's also the polarization in the society that people have to meet each other a little bit more. So that's maybe a little long shot.
No, but it's important.
It's important. Okay.
But I
I think it's also happened in Taiwan. So I attended a seminar about global aging, and I believe that Taiwan also have some kind of participatory survey to make sure about what the older people and the younger generation wants if they have a park, and they build their park face by face to make sure that it can facilitate the needs of the society, the people who live around the park. And yeah, I think many older people have a social gathering at the park, and it's really improved their quality of life, I think. Yeah. So maybe we can start with Indonesia. So is there anyone who wants to ask us?
My name is Yusuf Sutanto. I'm 81 years. More than 40 years, I do Tai Chi up to now, without interruptions here, every morning, without stopping. Now I want to share how I motivate myself to become consistent with this habit. I follow the Taoism, who move all the universe. If in the morning the sun rises, and at the same time the rooster also singing and the bird also, the dog barks, and also I have to also wake up and then practicing Tai Chi with the rhythm of the yin yang. This I did this already, and then I have written also several books on Tai Chi, and so also I'm a trainer of the Tai Chi here. This is my follow me every morning. You know. We use only 30 minutes in the morning because we are using IT not only for the retired people, but only for active people, because I have to clean our house also, to study or whatever. So this is the IT what I have already do it in Indonesia. Yeah? And I think IT will become the exercise for the tomorrow, because just on the 21st of March, UNESCO declares Tai Chi as a day for exercise worldwide. Yes?
That's great.
Now, there's a way between all these 30 minutes, and starting from the sit down on the chair, yeah? Because if already become older people and then directly after laying down on the bed and go to the toilet, then they have a lot of problems, yeah? Slippery and etc. And then I started our Tai Chi on the chair, and then starting slowly, and we gave it narration. So we explain that what I've done, the Tai Chi is like when I was in the womb with my mother. You know. Yeah, because the Tai Chi is actually starting from this. Yeah, this is not something coming from China. This is Tai Chi. This is from this side. Yeah. Then I, because I have a relation with Professor Hassan here, then I developed, I am inspired by the aku in Indonesia, aku me, yeah, and it become a plural, it become kami, yeah. And then you has become all of you, yeah. And then he or she, and we are all together. Yeah. And then the Indonesian language is interesting because they have a word of kita. Kita means in the diversity there is a unity. And the unity is also diversity. Or even unity is diversity. Diversity is unity. This is the interesting Indonesian language here. And then if I do this Tai Chi, then I will show you. Then I also, there is an exercise pushing hand. This is pushing hand. When I do this one, this I exercise yang, then become yin. Then now I become yin, then become yang again. Yeah? Then the air in my lung also absorbs it, comes to this lung. Yeah? Then in Indonesian language there is a word saudara. Saudara means one udara, yeah? Now, this is actually, this air also go to the tree, yeah? Then we become as a part of the mighty whole. So I think the scientists will have a strong foundation to become the future, yeah? Because we just have an experience with war in the East, in Gaza, yeah? I think this is, you have to exercise this point. We call it a point of vitality in the acupuncture. Yeah? And your breathing start from the Dantian, come here and then go to the here. And then you release it, come back here. And then again here, and within 30 minutes, The circulation is more or less about 230 years. So I think Tai Chi have a accountable, yeah? Or you can make a research, yeah? For the Tai Chi, yeah? So therefore I say, I will introduce now is our colleague here to become the exercise at the University of Indonesia. Yes.
Thank you so much, Papa.
Yes, thank you very much. I think this is a very nice illustration of how you can actually, so you talk about the nature and the birds singing and you getting up and you doing your Tai Chi, but you sort of factor it into your daily routine, and I think that's a great way of for you it's Tai Chi, for somebody else it can be cycling, or for somebody else it can be a walk, but I think that's actually the key, that it sort of relates to your own motives and in life, and then you can factor that in your daily routine, and then you do it every day, and then you don't have to motivate yourself every day, well, maybe sometimes, but most of the time you probably do it because, well, the birds are singing and you start. So that's a good, and that's with all activities, that's what we also notice we do a lot of research with young children. And if we go to schools, and I'm doing not that I do that, but if I would do a lecture there and say, well, you know, physical activity is good for your little children, and then they would look at me like, yeah, probably, but we're not interested. But what they're interested in, they want to hang out with other children, so they want to be social, they want to have challenges. And for you, for the Tai Chi, it's another reason, but it's you have to sort of have good reasons to do it, and then sort of close to those reasons, and then you will actually do it. So yeah, nice example. Thanks.
Once more, I put it as a
I'm not good at Tai Chi, but
therapy with the song, yeah. Because and then by doing like this, I put also music here.
Oh, yeah.
Yeah. So
Nice.
I hope that it become like a dancing, waltz dancing. Yeah. Therefore, it will be the exercise for tomorrow. To make the world become one. Yeah. Become one another, become one breathing. Only with one breathing, you make also make peace in the world. Okay.
And I think that what's also nice is that the Tai Chi involves other people.
Yeah.
So this is a social network. These are people that you know, and they are growing in the practice of Tai Chi with each other. Different generations come together. And I think that this is so important. Like, we have a center at our university, and people over 50 come for yoga and some strength exercise. And then when it was COVID, people did not miss the strength exercises, but they missed going for coffee or tea, or they missed their friends. And we see that social support. People have lost their spouse, or they have had a problem with the child, and they know that these people that they see many times a week that have become friends, you know, that this is an important social network. So Tai Chi is wonderful.
It's also pursuit for harmony with the environment, I think, because you realize the wind, even the sound of the bird, things like that.
We name it the Tai Chi is Tai Chi Nusantara here.
Oh yeah,
Therefore,
yeah.
you cannot find this Tai Chi
The name
even
is-
in China here.
Tai Chi Nusantara. So originally Tai Chi is from China, but here in Indonesia we call it Tai Chi Nusantara. Nusantara is a Sanskrit language for Indonesia.
Yeah, okay.
Okay, thank you so much, Bapak Yusuf. I think we still have one or two questions if anyone who wants to ask. Yeah.
Thank you. My name is Ratna. I was also a lecturer and now I'm retired. But I'm a member of MLB, Mitra Lansia Berdaya. empowered elderly, something like that.
Yeah.
Well, after your presentation, I think maybe the first thing to do is to put more attention to the younger generation, so the children generation, because I think they don't understand feeling as elderly. I reflect on myself. When my mother, and that was a long time ago, I think out of love we say, please don't do that, please go with the driver, don't use the public transportation, and my mother gets angry. And then one day, she was a little bit sick, and I said, please don't be sick. And then she said, I may not do anything, and also I cannot be sick. You all can be sick, and I have to attend for you, but I may not be sick. At that time, I was a little bit shocked, but that happens now to me. It's a karma. But I think the younger generation now are more stressful. They have to, it is not as easy as when I was 40 maybe. They have a financial burden, career burden, and so on. So if their mother or father gets sick, it means more stress. So, but they have to understand that we as elderly, we also want to have a meaningful life. So I do think a discussion is very important with love, but maybe we in UI can facilitate that kind of discussion, because there is no discussion. At home, usually we are very, there are many things to do for the family. Oh yeah, and one thing, in Indonesia there are still many grandparents who are living with their children. Formerly I was against it. I was really against it. But now I'm very thankful I have to take care of my grandchildren. So, and I think it's very normal. Why do we say that is not good and so on? Because it's very normal. When we were young, we are taking care of our kids, and my mother also take care of her grandparents, and now it's my turn to help my children with my grandchildren, if we can do it. So, but we should not say that living together with 3 generations is something we should avoid. Thank you.
So there is a lot of research on the impact of grandchildren by interacting with grandparents, and they find that it is very positive. It is a positive role model for culture, also for understanding, because it is across the generations. So I think that that is a powerful model. And I think that, you know, when children have experience of older people, when they grow up, they tend to hold less ageist attitudes. And like Bert was saying, you know, in a society, a multicultural society, sometimes we do not interact with people from a different culture. We do not interact with refugees or people of different age, right? And we can have a lot of misunderstanding, stereotype. And from social psychology, one of the best ways to break that down is to have actual dialogue, discussion between people. But as you say, it's the middle age of life that is, in an earlier presentation, I said, those are the people that are most unhappy. You know, young people are happy, and older people are happy, and middle-aged people are very unhappy because they have stress, mortgage, children, taking care of parents, money problem, right? So they say that I have no time. They have no time for exercise, and they have no time to sometimes listen to other people. So I think that, you know, what can we do to help this, you know? And I think that there has to be like exercise. If you do not make the time for communication, it is like if you make no time for exercise. You will not have communication, and you will not have a strong body. So, you know, I think that we have to do incrementally. It's very hard to change people's mind all at once. But if we can have shared activities, working on things together, this is a great way to have more dialogue. But I will also say, you know, when I ask my students, how old is old? They all say 40. 40 is so old. Because they cannot imagine it. They cannot imagine it. And I am 61. I cannot imagine to be 90. I have a lot of friends who are 90, but what will it be like for me, you know? And the other thing is that family is, you know, there have been a lot of things that happen in a family, good things and bad things that people remember, and maybe there are other things. So, but I still think a dialogue is good. Does that help? Does that answer your question? Yeah.
Well, the only thing I can add is that like you said, I mean, so we know from the students at our university, I mean, there's big stress there. And I think one thing is, well, you talk about middle-aged people, but students nowadays, and I think social media is one thing that adds up to it. So they have stress from, they have to work to get some money, they have to study, and then they have social media. Then you have to be a role model, you have to be perfect in every little way that you exist. And I have two daughters, and I sometimes say to them, well, for me it was easy. I mean, there was no social media, it was not even the internet when I was young. So we wrote letters.
Yeah.
And I mean, and it's also interesting in that sense how they deal with information, because in my time, this sounds a bit like old, but so when I was young, I had to search for information, basically, because if you wanted to find something, well, you didn't have a phone with you, or Google, or whatever you have. And then we had to go to the library, or sometimes go to another city to go to get books there and get information there. In these days, what is key, I think, is that they have to sort of filter the information, because you're basically overloaded with information. And I think that's one of the things that especially the young, well, that's what we see also with students sometimes, that they are overloaded with, oh, you have to do this, you have to do that. Even the university programs, if you look, when I was young, I mean, you had a couple of studies you could do, so it was easy to choose, although there's some wrong choices there, but that's another story. But so these days, there's so many programs and studies you can follow, so I mean, being young nowadays, it can be quite complicated, to be honest. And that also affects, of course, the parents, because they are from a different generation, not always understanding what the younger people are dealing with. So it's complicated, but I completely agree with you. You have to be in contact with your children and communicate. That's, I think, the basis.
What do you think about, I think many grandparents here believe that doing the grandparenting is part of their active life. So keep them active, but at some level also can build a feeling of overwhelm, because the kids can be very active and they can be like, they cannot run with the young kids. What do you think about that?
Well, I think you have to create situations like with what I meant with the playground. You can create situations where the kids can basically run around and do whatever they want, and the grandparents can just sit. And that's the same with doing activity. I like, for instance, what we do a lot is building communities. So building communities, well, for kids, but also all the different ages. And then, of course, you have to be a little bit smart to build a community that the children can run around and do whatever they want. They climb stuff and this, that. And then, for instance, the parents can just sit around, talk, and drink coffee or something. And the grandparents are there. Well, they can also walk around or help the children. So it's a complicated one, but I think you have to sort of do, and then not think one-sided like, okay, there's only a generation of children, and the next generation is the mid-career type of people, and then you have an older generation. Because if you think in those things, then it probably won't work, I think.
But then also, there can be sometimes where the grandparent has, the children leave the grandchildren with the grandparent for too many hours, or if the person is not that healthy and the child falls and they go to pick up the child, they can hurt themselves, right? So if it's too many hours, so they have done data on this, so if it's too many hours in the week, or the person is sick and it's too big a responsibility, then that can decrease the health of the grandparent. But by the same token, if the grandparent never sees the grandchild, then that is very bad too. So it's like most things, moderate, that doesn't hurt anyone, is best.
Okay, so that's also the part of being sandwich generation to know don't put any harm to the other generation. Okay, one last question.
Thank you, and thank you for Nancy and Bert. My name is Sita Purnami. My first degree is also coming from this faculty, long time ago. But then I work as a woman activist. Not work, but as a woman activist, and I learned many things. And in the past few years, perhaps since COVID time, I have particularly interested in elderly issues. So listening to what you just mentioning, of course we are talking in the psychology faculty, so everything is related on how as an individual we can overcome and strengthen ourselves to be more healthy and become active, aging or elderly. But then based on my experience as an activist, I feel that we also have to really link that with, and in psychology also doing that, but the link between individual and the society. So a bit illustration, I also a grandma, just 4 months old, my granddaughter. I'm 67 years old, so 67 years young, not old. The illustration is like this. So my son and his family working, so they have to hire a babysitter to take care of the baby. But then in Indonesia during Lebaran, the Muslim holiday, everybody will go home to their hometown. And when the time they have to go back again to work, the babysitter said, sorry, I cannot go back because I have to take care of my own children, my own son, because before I have to work to give them, to provide the money for the family, taking care of other people's children. But then I asked my mom to take care of my children. Then my mom now passed away, so I have to take care of my own children now. If you have patient enough to wait for me, give me another 3 months so I can come back to work with you. So this is the situation, yeah. And I think lots of people also facing this kind of situation. So what we are talking here is our experience as an individual to try to strengthen ourselves to become an active and healthy
elderly. But then this babysitter, coming from a different class of society, also facing the same situation, but then how they can also strengthening themselves to become active and elderly, healthy elderly and active elderly. So here I think the role of us here, particularly like Bahanu and also Ratna with the community of elderly, what call that? Powerful elderly. I'm just thinking on perhaps through your experience, because you also mentioned through your explanation on how to strengthen the public policy in order to help the government to also creating a better system. For instance, like when Taiji mentioned, Pak Yusuf mentioning that now it's difficult to listen to the sound of the bird in Jakarta, and perhaps also not easy to find a park to help people to form as a group to do Tai Chi. And I imagine those people, like the babysitter of my son, also do not have the luxury to have that kind of situation. And I think this is the role of us in order to advocate to the government to create more space for the community, and also perhaps launching a policy that is more inclusive, stimulating the interaction, just like Nancy mentioned. Yeah, so I envy when Nancy started to explain the situation in Australia. It's completely different from what happened, experienced in Indonesia. So I just like to get some of your tips based on your experience. Thank you.
Thank you for the question. You know, the last thing you said about Australia versus Indonesia. So, you know, each society has its own culture and history and traditions and aspirations, right? And so, you know, Australia is still a very individualistic society. And I think that is maybe not ideal, because the collective of people, you need that to solve problems, right? And if you look at some societies, these issues, you know, like caregiving or childcare, it's a gendered issue. So it falls to women to do these things. And it has a lot of ramifications in society of women not getting education, or maybe not working as long, not able to afford things, trapped in some cycles, you know, not able to age as successfully. And so we must have advocacy. I did a story in Poland, so I'm Polish, that is my ethnic background. And they said that the government in Poland says, oh, we do not need childcare because we have grandmother. No one can cook the food like grandmother cooks the food. We would never dare to have childcare when we displace grandmother. And this is, the women said, this is not fair, right? Not fair. So, you know, why should I just, and it is never grandfather, always grandmother doing these things. And also, well, you know, what if my mother has passed away? Like what you said, and then now who am I, you know, because there is no childcare, and oh well, I guess I just miss out. So the society is really pushing back on the government to say, you need to have a policy that is not relying on one sector of society to solve all the problems. And in Australia, many people say, oh, older people, there is a conversation, older people are useless. And I say, if all of the older people stopped caring for grandchildren and older people just for one day, the society would completely grind to a halt. Completely. And if you put a dollar figure on that work, it would be a huge dollar figure. And yet this is all voluntary work. So I really like your Society for Powerful Older People, and advocacy is really required to make sure that certain sectors of society are not forgotten and that the burden is too much on that. It is really a societal, political issue. And I think, though, that Indonesian society, your wonderful saying, unity and diversity is unity, right? But that also includes men and women and different generations, not just the cultural background. So I think you have a good foundation, and I hope to keep working with Hanum, so I come here and I help you.
Yes. Thank you.
And Bert, do you want to add additional comments?
As a man, I don't dare say anything. As a church man, we're a bit embarrassed now. I can only say, well, I think we're running out of time. No, I don't, in all honesty, I don't have anything. I think it's great phrase.
Okay, yeah, I think it's
I will show you some of the Michael Jackson. We use it for the pushing hand.
Oh, I see. So you use this song.
Yeah.
Push lagu. Michael
I
Jackson.
believe the younger generation.
Yeah. That's ideas from the people.
And this is a song we are the
Michael Jackson. Kamu kenal nggak?
Yeah, we're running out of the time actually because Nancy needs to go past 5. So, yes, thank you so much, Bert and Nancy, for such a rich and engaging discussion. And I believe that the audience also a part of this beautiful discussion about aging and active living. What struck me from this conversation is how much these two fields reinforce each other. And staying active is not just good for the body, it shapes how we age mentally and psychologically. And aging well is not something we prepare for only when we are old. It starts with the choice and habits we build today. So I also think that what came through clearly is that this is not just an individual responsibility. Like we talked before, the environment we live in, the policies that the government, that our city have, and the institution we part of, including universities, all play a role in whether people can truly live actively and age well. So on behalf of Faculty of Psychology, Universitas Indonesia, thank you for our two speakers here for traveling so far to come here. We hope that this is the beginning of a longer conversation and a longer collaboration. Thank you all for joining us, and see you next time.
Mau foto sebagai asisten kan? Sebagai asisten.
Gimana enaknya?
Oh, di sini. Kalau mereka berdiri di tengah, kita di atas.
Oh, you don't know?
Oh iya.
Pakai HP-nya sama. Pakai HP.
Bapak, Ibu boleh maju ke depan. Ayo maju.
Oh, it's from That is the color of my university.
All right. 1, 2, 3. 1, 2, 3. One more. 1, 2.
Personal photos.
1, 2, 3.
Bebas na.
Okay. 1, 2, 3. All right.
Yes.
Okay.